Okay, so I'm going to start with infection control, and I have my pen light and my stethoscope. I'm Rachel. I'm going to be your nurse today.
Hi.
Can you tell me your name?
Sarah.
Can you tell me what day it is?
Monday.
Can you tell me the president?
Obama.
Patient is alert and oriented ×3. Do you have any pain today?
No.
Do you have any assistive devices?
No.
Okay, I'm going to start with looking at your hair, and it's evenly distributed and good color. No signs of alopecia or hair loss. Your skin is evenly moist and warm to the touch. It's a good color. I'm going to look at your ears. Your ears are evenly sized. There is no drainage or extra cerumen. And check the other ear. No abnormalities. I'm going to whisper behind your ear, and can you tell me the word I'm whispering?
Lamp. Tissue.
Patient's hearing is intact. I'm going to ask you to remember 3 words. It's going to be couch, rug, and bed. And I'm going to have you repeat them at the end.
Okay.
I'm going to look at your eyes, and your eyes are evenly spaced apart. Your conjunctiva is pink, your sclera is white, and your irises are evenly distributed in color. I'm going to check your pupils. Your pupils are equally reactive to light and accommodate correctly. I'm going to check your peripheral vision. Can you tell me when you see my fingers?
Yeah.
Peripheral vision is intact. I'm going to check your 6 cardinal fields of gaze. You follow my pen. Vision is intact. I'm going to look at your nose now. It's evenly distributed on face, and it's symmetric. I'm going to look in the nares. There's no drainage or abnormalities. Your nares are set bilaterally. Can you breathe in by holding the nostril? And can you do the other side? Nares are firm. Can you smell?
Yeah.
Patient can smell. I'm going to look inside your mouth now. Your mouth is good moisture. It's pink. The tongue is set in the middle. There's no signs of dental cavities. Can you stick out your tongue and say ah? Tonsils are correct size and no inflammation or redness. Your uvula is set on the midline. I'm going to now palpate your sinuses. Tell me if you have any tenderness. The frontal and the maxillary. I'm going to palpate your lymph nodes. Lymph nodes are not palpable, no abnormalities or swollen or tenderness. I'm going to palpate your trachea and your thyroid. Thyroid is not palpable, no abnormalities or swelling. I am going to check your breathing. Can you breathe in for me? Chest expansion is good. Can you breathe in for me again? Chest expansion is evenly set, no abnormalities, no trouble breathing in or out. I'm going to check your lung sounds posterior, or I'm going to palpate your back. Tell me if you have any tenderness. No signs of masses or any abnormalities or edema. I'm going to palpate your chest as well. No signs of masses or abnormalities. I'm going to auscultate your lung sounds now posteriorly. Can you take a deep breath in? Another deep breath in. Another deep breath in. And another deep breath Lung sounds posterior are normal, no signs of trouble with breathing, no crackles or wheezing. I'm going to check your lung sounds in the front. Can you breathe in? Can you breathe in? And can you breathe in? There is no signs of trouble with breathing anteriorly, and no signs of crackles or wheezing. I'm going to now listen to your heart sounds. I'm going to listen in the second intercostal pace of your aorta. Aorta is intact and no trouble with the heart breathing nor abnormalities. You need to do your second intercostal space for your pulmonic. And then the third with the intercostal space, the fourth with the tricuspid, and the fifth intercostal space with the mitral. There is no abnormalities, the sounds were strong, no signs of swishing or murmurs. I'm going to check your carotid pulse. Pulse was strong on either side and equally rhythmed. I'm going to listen with the bell to your carotid. There again is no abnormalities, no weakness in the carotid pulses. They're strong and steady. I am now going to check for crepitus in your shoulder. No crepitus in the left shoulder. No crepitus in the elbow. I'm going to check for crepitus in the right shoulder. No crepitus in the right elbow. Can you stick your hands out for me? Okay, don't let me push down. Don't let me push up. Muscle strength is good. Can you move your arms around? Range of motion is good in the upper extremities. The upper extremities is warm to the touch, good color, good moisture, and check capillary refill. And it's less than 2 seconds on both fingernails. Now can I have you lay down for me? So I'm gonna inspect the abdomen. There's no signs of masses or striae or any abnormalities. I'm now gonna listen to bowel sounds. Bowel sounds are present in all 4 quadrants. No hyperactivity, but they are present. I'm now going to listen to your vascular sounds, starting with your aorta, which is right above the belly button. I'm going to move on to your left iliac, and now your right iliac, and your left renal, and your right renal. Vascular sounds were present and strong, and now I'm gonna palpate the abdomen, see if there's any masses or abnormalities. There's no masses. Is there any tenderness?
No.
No tenderness. Okay, can I have you sit up, please? I'm going to check for, actually, can you stand up? I'm going to check for crepitus in the hip. Can you move your hip out? And I'm going to check for it in the knee. No crepitus. in the left lower extremities. You move your hip out, and you move your knee. No crepitus in the right lower extremities. Can you stand, can you move your leg around and to the other side? Range of motion in the lower extremities is good. Can I have you sit for me? You stick your leg out. Don't let me push up. And don't let me push up. Muscle strength is good in the lower extremities. The skin is evenly pigmented. It has good moisture and is warm to the touch. Patient has capillary refill in both nails of the feet. And can I have you stand up? And can I have you walk right there and then walk back? And then walk back. Patient's gait is evenly proportioned, no swaying or limping. Can I have you stand on one foot for me? And can I have you stand on the other foot? Patient's balance is intact. There was no swaying. Can I have you close your eyes? Patient is evenly balanced with eyes closed. Can I have you close your eyes again? And can you tell me what body part I'm touching?
My left arm, my right leg, my left foot.
Patient sensation is good. I'm now going to have you bend over and like you're diving into a pool. I'm going to palpate the spine. The spine is symmetrically bilaterally. There is no signs of scoliosis, chordosis, or lordosis. Can I have you turn around for me? Can I have you go like this on each finger? Can I have you touch your finger to your nose 3 times? And can you do it with your other finger? Coordination is intact and motor function. Can I have you smile for me? Can I have you puff out your cheeks? Can I have you raise your eyebrows? Patient's cranial facial nerves are intact. Can I have you repeat the 3 words to me?
Bed, rug, and couch.
Great. So our short-term memory is also intact. And I think that is it.